This is Women's Eye View, an educational series covering thoughts, perspectives, and outlook on business, entertainment, fashion, finance, leadership, sex, health, and wellness through the eyes of women. I am Abla Doku. Joining us is Boston and Harvard-educated Dr. Andrea E. Williams, who established Women-to-Women Complete OBGYN Care PC in 1995, a year after she finished her residency in obstetrics and gynecology at Georgetown University Hospital, which is now merged with Capital Women's Care Arlington. She'll be sharing with us insights into uterine fibroids. Dr. Andrea Williams, welcome to Women's Eye View.
Thank you for having me.
What is uterine fibroids?
So uterine fibroids basically are a benign condition that we can find that's composed of a type of muscular type tissue in the muscle, sorry to be redundant, of the uterus.
And who is at risk for the uterine fibroids?
Actually, anyone can be at risk for uterine fibroids. For years, a lot of people, especially women of color, felt that it was primarily in their community. But we can find uterine fibroids with anyone. We can find uterine fibroids in women from Japanese descent to Arabic descent to, of course, African Americans. So we can find uterine fibroids with women, with different types of women.
And is this, based on what you just said, a lot of times there are diseases or illnesses or sicknesses that turn to affect one group of people more than the other. And in my family, for example, my grandmother, my mother, they've all been fine. I'm one of 4 girls. None of us have anything except for one of my sisters, the younger one, who actually had to have surgery. So is this something that is family, runs through families, or is just a random thing?
Absolutely, it runs through families. And if you want to put it that way, there's no question that if I have a patient who comes in and says that, you know, my mother had uterine fibroids or my grandmother had uterine fibroids, there's a high probability that that patient also has uterine fibroids too. But it'll vary as to what type of effect that person might have with the fibroids. Because fibroids, some women can have fibroids and they have absolutely no problems whatsoever with them. Where there are other people who can have fibroids and they might have heavy bleeding or pain, or you know, it might grow to very large sizes.
What are the options that are out there for anyone who find themselves with?
Sure. I mean, uterine fibroids are so very common. And believe me, it does not turn to a malignancy, but it definitely can, of course, cause problems with some women. So I always like to tell patients, I always like giving a list of treatment options whenever we're dealing with fibroids. And one of them, if it's not causing a problem, we don't have to do anything about it. You just leave it alone.
Not broken?
If it's not, exactly. If
Okay.
it's not too big, if it's not compressing other major important organs, then we can just leave it alone. But if it is causing a problem, then we need to look at what the problem actually is and think of ways, and look at ways to actually take care of it. So let's say if you have, so as I mentioned, there are a number of different problems that fibroids can cause. One of them is heavy vaginal bleeding. Okay. Now, usually, and actually I brought a little booklet here.
We would love to see.
Would you like to see my booklet?
Yes, please.
Okay. So here is
Can we
a
show
picture.
it to our viewers?
So with our viewers, if you can see here, this is a picture of what a normal uterus should look like. And as you can see, there should not be anything inside the muscle of the uterus. It should be completely clear.
Okay. And so, do you have one that can show us what it looks like if someone should have fibroids?
Absolutely. So, this picture here is a picture, so there are 2 areas here. But this is a picture showing where different fibroids can actually be located. And this is a picture which shows what fibroids, how fibroids could potentially affect a pregnancy. So again, really depending on where the fibroids are located will depend on what type of problems you actually have. So if you have fibroids that push inside more the canal of the uterus like these, those fibroids you would more likely have heavy vaginal bleeding.
Okay.
It might be heavier, it might be more prolonged. So these fibroids are fibroids that, again, can cause heavy bleeding. And one of the things that can be done in terms of taking care of the heavy bleeding, again, A, if you're not anemic and the bleeding is not incapacitating for you, again, we can do nothing.
Okay.
B, our options are what's called hormonal management, which really falls into the birth control pill grouping.
Okay.
So that sometimes can control the bleeding. C, there are some medications that are out there that can sometimes help slow the bleeding, like Listita. D, the other option is going in and surgically removing the fibroids, actually vaginally. So it's an outpatient procedure.
Oh, okay.
And this too can help control the bleeding. So these are things that can be done to help control fibroids that are in this location. Now, so again, as I mentioned, one of the things that fibroids can do is cause heavy bleeding. The other thing fibroids can sometimes do is cause pain. So if you have a large fibroid that's located in other locations in the uterus, those fibroids can cause pain, usually if they get to a certain size. If they're very small, they don't usually cause problems. So again, we look at our options of treatment. A, do nothing if it's not incapacitating. B, start taking some pain medications, some non-steroidals you can take over the counter, like your Motrins, Advils, Aleve. Can
the person just walk into the store and purchase this, or is this something that they have to go to a specialist for the specialist to say you can get these things over the counter to help with the pain?
Not necessarily. I mean, if you're initially having pain, you can definitely go over the counter and purchase Motrin or Advil. You don't necessarily need a doctor to tell you to do that. Now, the doctor can prescribe stronger doses of those medications, but you don't necessarily have to go to the doctor and they prescribe the regular, let's say 200 milligrams of ibuprofen that you can get over the counter. So, so those are some of the treatments that we can use for pain. The other thing, fibroids can grow very large, and so fibroids can grow very large. Some people have very large fibroids and they have no pain whatsoever with them. Okay. So I mentioned a couple of treatments from doing nothing to taking pain medications to hormonal management, but there's some other newer treatments that are out there that can also help with fibroids that I'm finding that a lot of doctors don't necessarily talk about.
Tell us about it.
Again, as I mentioned, if patients have fibroids in the canal, you can surgically go in and just remove those fibroids in the canal, and the patient does not have to have a hysterectomy, because for years, patients were usually, if you had fibroids, you had any problems, immediately the treatment was a hysterectomy. But now, again, we have other treatments that are out there that we can use to help with the fibroids. So again, if we're having bleeding issues, this is an outpatient procedure, meaning you go in that morning, you know, or whatever time your surgery is scheduled, you can go home that afternoon. And how long does it usually take for one to be healed back to their feet, back to work? Well, actually, often patients, you're out of the hospital that next day, and you know, usually I do my surgeries on Thursdays, and by Monday they can go back to work. Ah, perfect. Perfect. Another treatment for uterine fibroids is there's a procedure called a uterine artery embolization that radiologists do. And basically what they do is they put medicine in the blood vessels that supply the uterus. So what it's doing is it's decreasing the blood flow to the uterus. So this can help significantly with any bleeding issues that you can have. It can help potentially decrease the size of the fibroids that are out there. So this is another option that I'm finding that a lot of patients aren't given the option of doing. It's an outpatient procedure again. Your uterus gets retained. So is there a way that since it's not being, patients are not being told what their options are as much as they need to be told, is there a way that we as a community can put these words out there for patients, for women in general, to know that we do have options and that I think, in all honesty, any female who goes to see a physician for a condition that's not malignant, meaning there's no cancer associated with the diagnosis, I think that they should all be given a list of options as to how we can take care of different problems. And with your healthcare provider, you can then decide what treatment modality works best for you. You know, some people are fine taking the birth control pills if they're having heavy periods, whereas some people would prefer something more involved, like removing the fibroids. Or, in all honesty, I have some patients who I give my long list and they just said, well, Dr. Williams, I just want my uterus out. I want hysterectomy. And that's fine too, but you really have to sit and talk to the patient and figure out what works best for them. Because immediately just going and doing a hysterectomy for someone who has uterine fibroids is not what I feel is a good thing to
So
do.
that brings me to my next question. Removing the uterus, I assume, will have some negative effects on the woman?
No. Well, let me put it this way. I shouldn't say no that quickly. The anytime you do anything, there are risks associated with it. If you are having a major procedure like a hysterectomy, there is the risk of bleeding, there's the risk of infection, there's a risk of injury to other abdominal contents, there's a risk of anesthesia. These risks exist. Even in the best hands, these risks exist. So yes, there are risks associated with doing the procedure itself. But what you also want to look at is why you're actually doing the hysterectomy in the first place. So obviously, if we're just doing it for a benign condition like fibroids, and if you have a young woman, you don't need to remove their ovaries. If you remove their ovaries, you're putting them into a surgical menopause, which I would not recommend anyone to have if they are younger than their 60s. Unless they have a very strong history of ovarian cancer in their family.
I see. Okay. So removing the uterus per se, other than having the effects that can happen during the surgery, what about afterwards? Meaning, will that affect my hormones? Does that affect anything? Does it change anything?
No, because again, if your ovaries are still retained, then you will not have the same blood supply to your ovaries as you had before. So there's some women who get hysterectomies and they might afterwards complain of some hot flashes, and that might last a short time and then it goes away. But as long as those ovaries are retained, no, there's no hormones coming from the uterus itself.
And so I've heard of someone saying, okay, I did this surgery and now I'm struggling with depression. Is that a possibility at all?
Absolutely. Again, it's really important to look at the issues why a patient comes in to see you for the first place. If you're referring to just a hysterectomy in general, the question is, well, why is that person getting a hysterectomy? And were there other ways to take care of it? Some women, unfortunately, really don't want to have that procedure done. And that in itself can cause problems later. And that's why I, again, feel very strongly that if we have a problem that's benign, being non-cancerous, sit down, go over all the options. Don't force any woman to say, well, you have this problem, this is how we definitely have to take care of it. Because there's no question that you need to really see what works best for your patient.
Thank you so much, Dr. Andrea Williams, for sharing these thoughts with us. I really appreciate it, and I'm pretty sure that my sisters are watching this and they're going to be very grateful for all the information that you've shared with us. Thank you, our viewers, for joining us. That was Dr. Andrea E. Williams of Capital Women's Care, Arlington, sharing insights into uterine fibroids and treatment options. That does it for us today. I'm Abla Doku. Extend your view, extend your horizon. This is Women's Eye View. See you next time.